Good afternoon and welcome to our first Facebook Live from the Diabetes Alliance program. I'm Dr. Maria Elena Pena and I'm the director of the Diabetes Alliance team for Mount Sinai. I'm also the endocrine director at the Forest Hills location, also part of the Mount Sinai network. And today's goal is to talk about diabetes and nutrition. Unlike other chronic diseases, diabetes is unique in that it changes every single day, and it is truly dependent on activity, lifestyle, and nutrition. And to treat diabetes without addressing lifestyle changes and nutrition is really doing a disservice to the patients, because you really can't, there's no medicine, no pill, no injection that can really do it all when it comes to diabetes. It is one of those disease states where it's the provider and the patient that have to both be actively involved. So yes, the provider can help with medication adjustment and changes, but at the end of the day, the patient has to feel empowered to take control of their diabetes, and that's by making daily choices when it comes to their diet, their lifestyle, nutrition, etc. So today, in light of that, we really want to help empower our patients, and we will do that by teaching you about how it is that you need to eat to make it sustainable, because fad diets are just that. People have a diet this month and it changed, they lose weight, they regain. And as an obesity medicine specialist as well, because that's also my background, I always tell patients obesity is a disease state, just like diabetes, just like high blood pressure. If anything, you could think that diabetes, hypertension, high cholesterol is a consequence of obesity. And there's a lot of factors involved in obesity and unhealthy weight. I never tell my patients you are obese. I say you're suffering from obesity. There's a genetic, environmental, and behavioral component to obesity. So really, to treat one without the other is not proper. You really need to treat both. And that's part of what we do. So we want to teach you, a lifestyle. We want your diet and lifestyle to almost be second nature, just like brushing your teeth, just like combing your hair, just like your regular routines. Your diet should be second nature. And another thing I like to tell my patients is if you were diagnosed with cancer, let's say, and they said, okay, but you can cure it or put it into remission if you change your diet. People will do that because they feel that with cancer, death is imminent. But diabetes doesn't kill you overnight. It kills you slowly, right? It's slow death of your vital organs, of your brain cells. When patients get, for example, a stroke, of your eyes, patients that have retinopathy or bleeding behind the eye, neuropathy, nerve pain, their kidneys and other organ systems, right? The heart being the main one. If we think about it, diabetes is a #1 risk factor for heart disease. So with diabetes, it's almost like a slow death if we don't take that initiative. So when you present it like this to patients, when I present it like this, I feel that patients feel, okay, I have control. I'm not the victim. It's not going to be something passive. And we have an excellent team of CDEs in the program, certified diabetic educators that are really, really committed to helping our patients. They take the time to sit down with you, to listen to what do you like to eat? What do you not like to eat? What's your lifestyle like? What are some of the barriers that you have that prevent you from healthy eating or from exercise? And today presenting with me, we have Maria Fraga, who is amazing. She really, really is passionate about doing this work. She's very committed and she's very knowledgeable. I learn from her all the time. So without further ado, let me introduce Maria Fraga.
Hi, everyone. So I'm a registered dietitian. I'm also a certified diabetes educator. I work for the Mount Sinai Network at multiple locations, but here in Regal Park, Mount Sinai, I work with Dr. Maria Pena, and together we see patients, as she mentioned, with prediabetes, diabetes, and also who come in for the management of the management of obesity. Today's presentation is going to be focused on how to better understand how to plan for a healthy lifestyle. What are the tools you need to get started? How to shop and prep and cook, and how to lead a balanced meal plan. And basically it's being part of a realistic plan so that you can carry this long term, and it's not a diet, but a way of life. If you can go on to the next slide, please. So in today's goals will be to help you, empower you, and give you the knowledge to get you jump started, to get you motivated, to start a healthy lifestyle for yourself, for your family. And what does that require? Just starting small and achieving some results, and so continuing on to see the bigger impact. So it's not getting it all from the start. It's carrying it over a period of months and maybe even further than a year to see the results you're seeking. Learning about diabetes, what are your blood sugar goals, how to eat to better control those blood sugars, testing your blood sugar if that's partly part of the plan that your provider has a conversation with you about doing. Also integrating mindful eating, practicing this more on a daily basis, not for a short term, but how can you get started with a new plan? Not feeling guilty about what you eat or feeling shame behind what you eat, but being empowered to eating healthy so your body feels a different energy. Finding satisfying meals, delicious, using lots of herbs and spices, and also adapting healthy snacks, which we're going to review today. Choices that you may not understand right now because you have never been given the presentation about how to do combo snacking, but how this can also impact your blood sugars when you combine food groups together and not just having one food group alone. Gaining the awareness of foods, learning about what are lean proteins and healthy fats, what kind of vegetables are starchy and which ones are non-starchy, the importance of eating fiber and complex carbohydrates, and also bringing your whole family into this, not something you're just doing on your own, but many times when we eat as a family, we eat the same. So if you find that there's something that you found out your cholesterol's high, you're dealing with high blood pressure, maybe someone else in your family eating at the same table can benefit from healthier eating. Next slide. So I don't know if you want to talk about this, Dr. Pena, about the different programs we currently offer our employees and patients.
Yes, I'll briefly mention. So the Diabetes Alliance is a resource that is available to both patients and employees. And like I said, it's a group of certified diabetic educators. We all work together. We all collaborate. And again, a very committed and excellent team that's very knowledgeable. That's also another thing. When we're talking about a dietitian, many people just, put a shingle out the door and say, oh, I'm a dietitian, I'm a nutritionist, but do they have the knowledge, the appropriate knowledge in the background? And that I can assure you that we do here at Mount Sinai. So we have the Mount Sinai Wellness website as well. If you can click on this, you'll see many links, not only for nutrition, but it talks about how to incorporate physical activity into your lifestyle. Many times I tell my patients, it's not like Maria said, it's hard to say, okay, now do 30 minutes every single day, 5 days a week, according to the American Heart Association. If you're a person who has had a sedentary lifestyle, making that drastic change will be almost impossible for some people just because of lifestyle, work commitments, etc. But if I tell you, okay, let's do something gradual, some chair exercises, work five minutes a day, that's more attainable. So that's part of what we do. We do a little bit of goal setting, attainable goals. So that's one of if you go onto this website, you'll see a lot of these links. There's a wellness flyer at 42nd Street. They have a program there, which is available for everyone in the system. We have an area that talks about healthy eating during the holidays, healthy eating during vacation. We have, like I said, the Mount Sinai Fit video that teaches you about physical activity. We have this Lunch and Learn series. We have meal plans. Many times patients tell me, I need something that's specific. I need just a structure. So we have that available. We have 30 days samples, and you can mix and match according to what fits your needs. So we have all of these resources available online, and this is just another resource that we're giving our patients right now, this Facebook Live series to teach you even more. We can go on to the next slide.
Perfect. So how do we get started, and where do we start? So let's say, starting with number one, allowing yourself to become aware of your positive nurturing opportunities, thinking about your mood and physical health. If you are managing your blood sugars, what foods you should be selecting and preparing. For example, visiting a local farmers market, using seasonal foods for, for their nourishment. We'll talk about mindful eating today. Also, eating healthy requires a cognitive decision on your part, and meal prepping, cooking, shopping, carrying foods and snacks to your work environment. For many of those that are working from home, setting up your home for meals that are healthy, keeping healthy snacks around. Also, not keeping food around your workstation that just invites for snacking and grazing. What are your beverages? What are you drinking? Is there sugar in what you drink? We get a lot of excess calories from, fluid and beverages. So, assessing that as well, not only just solid food. And also learning about being in the present when you're eating, not feeling guilty about what you're eating, but being more mindful of flavor and texture and smells, and thinking about quantity. Think of the quality of what you're eating. Learning about your hunger scale, which we'll be reviewing in the next slide, about how that is a skill that is very useful. And if you can start with this as one of your first goals, to understand your hunger scale, understand when you're hungry, when you're satisfied, comfortably satisfied, or extremely full. Next slide. So for many of those who have never seen this, it's just a scale. It runs from 10 to 0 and 0 to 10. So extremely hungry, extremely full. And those are the two extremes we don't want to ever be in. Those are more like holiday eating days, Thanksgiving, when there's just so much food and you just keep eating and eating just for the sake because it's there, not so much because of hunger. You never want to be a 0 either, and you never want to be a 10. So think of somewhere in between, like the preferred numbers like 4, 5, and 6 on both ends. You want to be somewhere where you're comfortably full. And that sometimes requires being responsible or taking action of serving yourself on a smaller plate, or, choosing what's most important for your health, like lots of fruits and vegetables, less carbohydrates, lean proteins, not starting with many appetizers if you're dining out, or just being selective of what you're eating. And then when you're actually in the action of eating, taking the time to really focus on the different numbers throughout the scale as you're reaching that comfort zone. If you're at a 2 or a 3, that maybe is a time for a snack, but it's not a meal time. It's just a little something to carry you over to take the edge off, like an apple, a string cheese, a boiled egg, until you sit again. So this is a great technique, a great skill. And I think of this as anything in life, like shopping or friendships. But when it comes to food, really being in the moment of what you're eating. So when your body signals you that you're full, it's time to rest your fork and maybe think about, taking the rest to go, or maybe learning from how much you've served in excess. And maybe for next time, serving yourself less and allow yourself to say, I would like a little more. And the seconds would be just vegetables or salad. Next slide. So how do we disconnect? How many of you find yourself being similar to this gentleman on this slide, where there's just, we just don't have time to really turn off all external noise, which means our phones, our computers, just sitting quietly and eating when you're eating. So really disconnect from outside distractions. Take time to enjoy the flavor and textures of what you're eating. This is another skill that many of us don't practice. We eat and drive. We are working through our lunch shift. So taking whatever it is, it could be 5-10 minutes just to eat something and savor it. You'll realize you'll have much more appreciation for the flavors and foods that you've chosen. For those who don't practice such an action, sometimes you eat something and you don't feel satisfied, and then you reach for something else. And this is where binge eating comes in, where nothing really satisfies you. So you need multiple things to finally feel like now you're feeling satisfied. So really disconnect when you're eating and connect to what you're eating.
Maria, I just want to add to that, again, to basically reinforce what you're saying about the mindful eating, is that sometimes when we're so consumed by multitasking, our body forgets to process the fact that we are eating. And we can sometimes, without noticing, forget that we actually ate. We'll be like, oh, did I eat? When in fact you did eat. So many times when I tell a person, oh, do you eat? I don't eat anything, but I do a 24-hour recall. Like, tell me everything that you kind of touch, snacked on. Oh, well, I didn't eat a full meal, but I was snacking throughout the day. So we sometimes don't count that as food, and it is. Anything that you put through your mouth is going to count as a calorie, is going to count as a carb. So just again, to what you're saying, you have to just be mindful. Okay, I am eating it, and try to savor that. Another thing is that sometimes we think that we're still hungry. If you can use this tool of waiting at least 10 minutes. This happens mostly for nighttime, especially or holiday eating, where we're eating because it tastes good or because we're just consumed in the moment, talking, socializing. But give yourself 10 minutes, because there is a little lag time between the stomach, those stretch receptors in the stomach and the brain. So it takes a little bit of time for that signaling from the stomach to reach the brain. And that's why when we overdo it, when we're looking at the hunger and fullness scale, we're like, wow, I feel sick now, because you never gave your body time to process what you were eating. So just want to add that.
Also, if you're eating fast, you're going to
Mhm.
overeat. And by the time you actually feel the senses of fullness kick in, you just eat so much. And then you're in the other extreme, like number 10 again. And some
Exactly.
people live on two extremes. They're on 0 or 10. They wait so long till they finally eat. And then when they do eat, they eat so much. And then again, a lot of time goes between the next following meal. So they're living on a 0 or a 10, where you want a patient to be around a 4, 5, and 6.
Correct. Yep.
Yeah. And if you go to the next slide, that's where the paying attention to what we eat kicks in. For this slide, we use a strawberry, but this could be anything really. It could be a piece of chocolate. It could be anything that you really enjoy eating, but taking the time to use all your senses to really be in the moment of the texture, of the smell, of the color. You know, how many of you go to a market and pick up an apple and smell it? It's very rare that you see someone smell like the smells of what's in our food. Dissect kind of like all the food in your mouth while you're chewing it before you're swallowing. And remember, digestion begins in the mouth, not in your tummy. So the longer it takes for you to eat, the better will be long-term for the whole process of digestion. And also, you know, even drinking water during the meal does help with transit. People who don't drink enough, who are not well hydrated, those are the ones that suffer from like constipation, and also even like maybe overeating, because water occupies space in your tummy, and that's part of the meal, is drinking and eating together. Yeah. Next slide. I don't know if you want to talk about the hydration. You did mention it before about drinking, yes, and how sometimes there's a missed message between hunger and thirst.
Yeah, so this is basically reiterating the same thing. For example, so I think that waiting that 10 minutes will help you. Also, in regards to hydration, yes, many times dehydration can be mistaken for hunger, and people that are relatively dehydrated tend to feel like they're down, they're fatigued, they're weak, and they misconstrue these signals. Oh, I need sugar, I need carbs. So by hydrating, that really helps take care of that. You'd be surprised the lack of water we have. So much so that I have patients, for example, I love my cup of coffee in the morning, and coffee is not bad, it's what we put into it. So we want to try to not put a lot of sugar or syrups in it. But let's say you have coffee in the morning. Ideally, after coffee, you should have water. Why? Because coffee can dehydrate you. So you're supposed to take the coffee to help wake you up, perk you up, but then you feel within an hour you're tired. So you should have your coffee, and then after that, try to hydrate as well in order to keep your energy up. And also, if you want to mix it, I always tell patients there's so much you can do with water. You could put slices, of oranges. You can do like a fruit infused water, which is fine. You can also put lime or lemon in it to make it not as bland. Another thing that you can do is boil some green tea, boil some ginger, make a large pitcher and use that throughout the day without adding sugar to it. I tend to steer away from some flavored waters that have artificial sweeteners. And I believe you too, Maria, agree that we're more in the mindset of more natural. We want to stay away from the artificial things. So I'd be wary of artificial sweeteners, because that can lead to other stomach issues, for example, indigestion and bloating for some people. So I try, sometimes if that's something that will make you drink more water, then go for it. But if you tend to have IBS, irritable bowel syndrome, constipation, bloating, I will stay away from that and just do things that are natural.
Perfect.
Next slide. Yeah.
And so now we get into like making food choices and what are the things that we would want our patients to really focus in on are the lean proteins, the foods high in fiber, and also, you know, really bringing in those vegetables, those non-starchy, very satisfying vegetables and greens that add the bulk, the volume to our meals. Next slide. So here you see the plate method, which is very effective. And it's very simple to use. Basically, take your plate, divide into 3 parts, and half the plate to really be full of vegetables, non-starchy vegetables. Corn and peas are not vegetables, they're starchy vegetables. So you want leafy greens, you want lettuce, you want tomatoes, cucumbers, all the vegetables. They could be cooked, they could be sauteed, they could be roasted, or it could just be a big tossed salad along with your lean protein and your 1/4 of the starch. And if you start with filling your plate up with vegetables, there'll be less plate available for you to add the pastas and the rices and other starches that those are the ones we want to really be careful with, because those are the foods that alter your blood sugar and have the greatest impact on elevating your sugars and bringing on the uncontrolled diabetes. Next slide. This is just another example of how to use the plate method. On the side of the vegetables, you see all the different choices that you can choose from. I would be careful with what you put on your vegetables. Be careful with oils and toppings. You get extra calories doing that. But then you also have a list of the proteins, the chicken, fish, tuna, turkey, egg whites, lean beef, tofu, and any of the fishes. Nuts also will fall into that category. And then you have all your carbs. And so fruits are carbs and dairy is a carb. So if you are doing carb counting, don't forget that fruits do, play a big role with patients with diabetes. You don't want to do excess fruit because then you'll see weight gain come from eating a lot of fruit, and also maybe, changes in your blood sugar. Next slide. This is a nice, simple way of putting our foods into categories. You definitely want to, increase your healthy fats. You want to stay away from saturated fat. Those are the fats that lead to cholesterol and high triglycerides and heart disease. You want to focus on lean proteins and how are you cooking your proteins? Preferably avoid frying, deep frying. Adding cheese and bacon to your food. That's just adding extra fat and calories. And then you have a nice list of vegetables that you can, use and, pretty much substitute. Many people don't like vegetables. For those that, don't prefer vegetables, you can go with salads, or maybe there is a few vegetables that you like and you can just look up different recipes, or adding vegetables to rice dishes or to pastas. And then you have the high fiber whole grains. So this is where you're going to feel the fullness from these foods. These foods also delay how your blood sugar spike. So definitely getting fiber in your diet will be very helpful to managing your blood sugars.
Maria, just to add, for the people that don't like veggies, I find my trick is an air fryer. I think investing in an air fryer makes it nice and crispy. So I think that alters the flavor a little bit, makes it more palatable. Okay. And I find that people like it a little bit more.
Yeah, right? They're easy to make in the air fryer. Everything
exactly.
They're accelerated.
Quick and easy. Yep.
Okay. And then the next slide pretty much brings it all together. This is one of our simple slides, simple handouts that we give our patients. It's just for 3 days, but it gives you 3 different days of how you can incorporate a healthy meal plan. Your cereals, your low-fat milk, your protein, lunch and dinner, definitely, getting that half a plate of vegetables in. And then you have some snacks on here. I think snacks are fine. If you're hungry for a snack, it's great. If you feel like you've reached that time of day when it should be a snack time and you're not hungry for it, it's fine. Maybe it means that you've made changes in your diet and now your foods are more satisfying and you don't eat the yogurt mid-afternoon, or you don't need that extra apple mid-afternoon. Maybe you're fine and you can wait until dinner. So this is just a simple example. We do have this in a 30-day meal plan, and we do have it available for our patients. Next slide. So this is what I was saying before about combo snacking, about combining fats with protein and carbs with protein. So think of apple and peanut butter, or Greek yogurt with some nuts, some celery sticks with peanut butter. You can do the same thing like vegetables and hummus. You can do guac and veggies. A boiled egg is great as a snack. You don't always have to have it for breakfast. You can do sliced vegetables and dunk them into a favorite dressing. Just be careful with dressings and hummus because they do have calories. You don't want to just eat in large quantities. Measuring is better. This way it's limited. When the snack is over, it's over. Again, snacks are not a meal. So it's just a little something to carry over, take the edge off until you sit for food again. Next slide. You may want to talk about this one, Dr. Pena, because this talks about heart disease and maybe medications surrounded, around cholesterol.
Sure. So many times, many of our diabetics, because diabetes in itself is a risk factor for heart disease, we really want to minimize everything that can contribute to heart disease. So along with diabetes, we do have stricter cholesterol goals, meaning we want our total cholesterol to be lower. We want our LDL, which is our bad. I always say L for lousy cholesterol to be lower, and our HDL, H for high, to be higher. The best way to increase your HDL is through exercise. That's really the best way to increase that. And genetics, that also plays a role. Women tend to have higher HDL levels than men due to their estrogen level. Postmenopausal women tend to have HDL similar to men because of the lack of estrogen. But yeah, so it's very important to, when you're trying to control your carb intake, you also want to be mindful of your fats, especially your saturated fats. So like Maria was saying, avocado is great. Sometimes something like hummus might have a little bit of fat in it. That's okay. Olive oil, these things are healthier fats. Nuts, the unsalted nuts are better. But things from animal fats, so bacon, lard, whole milk, creams, butter, and certain oils, all these things are very fatty. Also, the fats, found obviously in fried foods, chips, crackers. That's why I tend to say about the air fryer, because with air frying, you still get that crispy texture, which we all like, but with less amounts of fat. So you do want to be mindful of even though I'm a big proponent of higher protein intake, I feel that a lot of patients don't have enough protein and fiber in their diet. And like you were describing, it's all a matter of displacement. If you have protein and fiber in your diet, and veggies, many times the fiber comes in the form of a vegetable, you have less room for the carbohydrate, which is what tends to impact your glucose level. So many times, and I also have the other extreme, many times my patients tell me, oh, I don't eat anything fried, I don't eat anything oil, but they eat starch, and that's what increases your glucose level. So understand that rice, bread, pasta, which doesn't have oil, that tends to increase your glucose level. Something like fried chicken won't increase your glucose level. However, the fat content can lead to higher LDL levels, which can increase your risk for heart disease indirectly. So you want to minimize that. So you want to have, if you're having chicken, try to remove the fat, or have the breast. If you're try to limit your red meat, you can have red meat. Even sometimes I have ground beef, I try to get the leaner version of it, or cut off the animal fat and try to limit that to maybe once a week or whatnot. But turkey is a better form. Your fish, those are all better forms of protein. Beans, excellent source of proteins without that animal fat. So you do want to be very mindful of the animal fat. That's also why I have an issue with some people that tend to do these fad diets, for example, keto diet, Atkins, very effective in weight loss. And it's not that it doesn't work, but you have to be careful, because if you overdo it with the animal fat, you'll fix one thing, you'll have the weight loss, but you'll still affect your LDL goals. In keeping consistent with talking about heart health, we also have to address blood pressure. So as a diabetic, we have cholesterol goals, we have also blood pressure goals. So with blood pressure, you want to keep it ideally less than 140, sometimes less than 130, depending on what your cardiologist, primary care doctor tells you. You want to keep it under control. And sometimes, as we just explained with diabetes, sometimes medication is just not enough. You need to do your part when it comes to diet. So yes, losing weight, exercising can help. It actually helps relax the vessels in your system, thus bringing down your blood pressure. Meditating, decreasing stress, those things can also help. And we all know that's very hard. That's another presentation for a different time. But when it comes to blood pressure, it's really affected by sodium. So sodium holds on to water and increases blood pressure in the system. So you really want to avoid sodium. And there's hidden sodium everywhere. There's really impossible to have a sodium or salt deficiency. And canned foods have this. So we're going to go, let's go to the next slide.
Mm-hmm.
So it tells you what the average intake is. So it's very easy, as you can see. The average adult eats over 3,000 milligrams of sodium a day, and that's very easy. That's easy. You can find that in your cereal and soup. You go to, let's say, any store, get some soup. Canned soup, for example, has a lot of sodium. Cheese has a lot of sodium. So it's very easy to accrue those sodium points throughout your health. And again, so why is it so important to control your blood pressure? Is because it does lead to heart disease, and it also increases your risk of stroke. I tell people, think about a hose that's running at a very high pressure with water. At one point, it'll pop and leak, and that causes a problem. If that happens in our brain, that's how we have what's called a hemorrhagic stroke or a bleeding stroke. Also, with the arteries and going to the heart, so if you overextend the chambers of the heart, you have what's called cardiomyopathy or hypertrophy, and that affects the pumping. That's what leads to eventual heart failure. So it's very, very important to monitor the amount of sodium that you're taking in. Next slide. So here's just a list again. So your snacks, so your chips, your popcorn, your pretzels, even when we mentioned peanuts, that's why we said unsalted peanuts, because peanuts are a great source of fat and protein, but it can also have a lot of salt in it. So you want to get the unsalted version. We also recommend sometimes popcorn as a quick snack, but if you get the salted version, you're also adding to that sodium consumption, which leads to higher blood pressure and leads to water retention as well. Obviously, canned foods tend to have a lot of sodium because it's used as a preservative. You also have your processed meats, your cold cuts, your salami, your cheeses. Those things tend to have a lot of sodium, especially during barbecue season. People tend to have higher blood pressure because they're having all of these processed meats. Frozen dinners, that's also another one. So even I'm not going to mention any brands, but some of these like healthier options that people think, oh, it's just a frozen meal. It's like healthy, it's low carb, low fats, but it has a lot of sodium in it. So you want to try to avoid that as well. Even things that are deemed as sweet, so some baked goods still have a lot of sodium in them because of that preservative that they had to add. Next slide. Here again, we're going through the whole thing of hidden, and I guess Maria, you want to add to this? These are just another list of things that have
it's just another list of like box items that potentially have a lot of hidden sugars and salt. So reading food labels are very important for you to do, so you know what you're buying and compare it.
Yeah.
Allow yourself some time in the market to compare different labels and different items on the shelf. You know, it will help you, for further shopping experiences. Just go directly to the items are better for you to choose from.
Exactly. And the things that, if you look at these things don't taste salty. That's the trick. They don't taste salty. So you're not, you think, oh, I have a low salt diet, but yet if you look at the food label, they tend to be higher in salt. So you have to be very careful. Yeah. So next slide.
This is just an example of all natural tomato versus canned. So canned foods are naturally preserved, and so there's sodium added to that. So really reading the label for low sodium or no salt added items will help you keep to a low sodium, but definitely a fresh tomato or making your own fresh tomato, sauce would be the best way. You can use your own spices, avoid the sugars in these canned foods or, packaged items. Like tomato sauce has a lot of sugar as well, ketchup, other sauces that we add to food. So not only sodium, but there's sugars also hidden in these products. Next slide. And then meal prepping, creating a menu for the week, using the flyer and just, really using what's on sale for that week at that market. Not shopping when you're hungry helps you eat and shop for better quality food. Cooking extra for extra meals will also allow you to have food available for other times when you're hungry, and not having to just pick something quickly that is maybe not the best choice. And keep it simple, bring leftovers to work, prepare your meals at night, or when you're cooking dinner, make a batch for the next day for lunch food. Or choose 1 or 2 days of the week to make extra so you're not cooking every day. Cooking takes a lot of effort and time, so cooking extra for other times of the week. Also cooking in batches, like the roasted vegetables, make a big tray in the oven, roast your vegetables. You can, barbecue your vegetables. Same thing with strawberries, like prep everything out at once. You're not cooking and washing on a daily basis. And the next slide would be the summary, which Dr. Pena, if you want to summarize basically the key points to our conversation and talk today.
Okay, so again, in summary, we treat diabetes not only with medication, but with diet and lifestyle and exercise as well. Today, we kind of went over, it's an overview of how we have to eat, like tips on how to avoid hidden sugars, hidden salts, and hidden fats that can alter our metabolism and fundamentally also alter our hunger cues. We are what we eat. If we eat cleaner, we eat better. I always tell my patients, eat as if your food is going to rot in a week, that's actually better for you because it means it's fresher. If it's going to last, it means it's more processed. So you want to avoid those processed foods. You want to eat cleaner. You want to eat more fresh. You want to increase your fiber, your vegetables, your protein, because all of these things will naturally curb your hunger, thus letting you eat less. It will also help curb your sugar levels and ideally allow you to have better A1C control with less medication. And you want to also have this, share this with the rest of the, you brought this up, Maria, from the very beginning. You want to make this something that's with your family, your friends, because we tend to eat with our family and friends and colleagues. And you want to kind of share this knowledge. If everyone's on the same page, it just makes it easier to all engage on this, healthy endeavor. And then, so that's basically it for today. If you have any questions, please let us know.
We look forward to working with all of you.
Yes, thank you.
Thank you. Have a great experience listening to our talk today, and hope to see you again at future webinars.